Go ahead.
Thank you. So it's a question related to the president's upcoming speech on Wednesday. I'm wondering if you could talk a little bit about why it was important for the president to actually deliver the speech at the Capitol building versus, remotely here from the White House, given everything that happened on January 6th and given the concerns about, the coronavirus. Why is it important for him to, physically be there?
Well, first, the president was in the Senate for 36 years, and he is a person who has not just a long history, but a great deal of respect for the institution of government that is Congress. And he also recognizes, as we all do, that it's an opportunity to speak to the people who you will work with in partnership to get business done for the American public, but also to speak directly to the American people, as this will be a prime timed address, as it always has been throughout history. And so it is an opportunity that he's been eager to take advantage of. Obviously, we've been working in partnership or in cooperation with the Speaker's office for the last several months. And as you touched on, certainly there were unique factors this year. Obviously we always take into account security, but in doing this in a way that is COVID safe is something that the Speaker's office and leaders in Congress are very cognizant of. Go ahead.
Hi. Two questions. First, from someone who can't be here due to coronavirus restrictions. The New York Times is reporting neither drug pricing nor health coverage will be part of the American Families Plan proposal. Is that accurate, and is the president still committed to getting those done and discussing them in his speech next week?
Well, I expect the president, as I noted, to talk about the American Families Plan in his joint address, as well as a number of other issues, as I answered in response to Jeff's question, important to him, including health care, the need to put in place police reforms. He's made clear his commitment to expanding access to health care. It's why he opened a special enrollment period during this pandemic. We're excited by the progress we've made. More than 500,000 Americans have signed up for coverage since the president was inaugurated. It's why he put into the American Rescue Plan subsidies to make it more cost effective for many Americans. And of course, the president's number one priority has been tackling the greatest health crisis our country has faced in generations. And just a reminder, again, this is a speech. It is an important moment, it is an opportunity to lay out his agenda, but it will not represent the totality of every proposal he wants to achieve during the course of his presidency. It is also still being finalized, and the president will do some thinking work himself on it over the coming days.